Do you have any idea about this word in medical science? Yes, last bench, middle row, middle one. Do you have any idea? You don't need to stand. What is this about? So, how can you word the use immune in the definition of immunity? If you want to define immunity or if you want to explain it, then how can you word the use immune? You have to tell something else. You cannot describe one word by the same word by the same word. Immunology in your syllabus is a part of hematology. As mentioned by the NMC, immunology is again like every other thing, like hematology we are completing in say maybe 2 months or so, 2 months. If you take like that, how many sessions, 1 hour sessions, maybe 10 like that. So, hematology can carry on for a few years. So, everything in medical science is vast. Likewise, immunology is a vast thing. I think they have included it as far as I remember in our times or even maybe earlier or later. So, this was when the syllabus was not that, medical education syllabus was not that precisely this, there was no curriculum as such by these topics by this NMC or the medical commission. So, we used to discuss it along with WBC. So, now they have just see the relevant competency in it is under hematology. So, I think they are trying to communicate that we should only discuss the very basic things of it related to. So, we read about these WBCs, the types of WBCs, neutrophils, eosinophils, basophils. They have certain roles, lymphocytes, monocytes, they have certain roles in protection of the body against invading organisms. So, just look at the slide, it refers to the resistance exhibited by the host towards injury caused by microorganisms and their products. So, if we take it philosophically rather than medically, we can say that it refers to everything that outside, whatever is coming from outside which affects us to protect us physically against that, everything, every component which protects us against that falls under the purview of immunology or immunity. But if you have to define it medically, then you have to tell microorganisms as their products. Host means the human being, the individual. You will read about the causation of diseases, how diseases are caused, or the not how diseases are caused, but the causation and the effect of diseases. You will read 3 words or 3 words you will come across when you read community medicine. Maybe you have already read, some few classes of community medicine must be going on in the first phase as well. There is one lecture session. So, agent, host and environment. So, it depends on agent, causative agent, host and environment. So, that is what the meaning of the host, the individual who is affected. Environment means the environment. So, anything in the environment, any microorganisms they are telling, not only microorganisms, any environmental cause which may affect the body, but the body is protecting against that. Any may not be only microorganisms, maybe say pollen grains from plants, some plant. So, they are playing a role in allergy. So, who is combating it? Eosinophils, basophils are helping to combat it. So, that also falls under the purview of immunity. It is the body's defense mechanism against infection as diseases. Yes, infection, every term you have to define medically. Infection, what is the meaning of infection? That is invasion by an external agent. These definitions you will read in community medicine. So, this is what is immunity about. Now, again vast topic, we will try to cover the basics in maybe 2 or 3 sessions maximum. We cannot afford more than that. We have to cover the whole the rest of the topics. So, in your syllabus it is given under the purview of hematology. You will again maybe, I do not know your microbiology syllabus, current syllabus, which has been decided by the NMC after these, but immunology is a part of, in microbiology it is discussed maybe in more detail than this. Okay, immunology is a vast thing. There are several textbooks. That means one textbook on immunology, one whole textbook on hematology. There are several textbooks like that. So this is a very simple definition. So again, same thing, ability to protect against microorganisms or ability to protect against foreign bodies. This also refers to disease resistance, and sometimes we try to understand from where the word comes, or it is better to understand something, the origin of the word. So it is, the immune is a Latin word which means free from burden. So here burden refers to disease caused by microorganisms or their toxic products. So we'll discuss immunity under some headings. We'll discuss some things, I'll not say headings, but few topics which we'll cover. We just have to recapitulate about the WBCs. What are the functions of neutrophils, eosinophils, basophils? You must be knowing this. Lymphocytes, monocytes. What are macrophages? Yes. Second bench, what are you doing? What was discussed just now? If you remain inattentive in the class, what is the purpose of attending the class? Do you know what is a macrophage? You don't need to stand. Macrophage does phagocytosis. What it is? What cell it is? Where from the cell is derived? Macrophages are, where are macrophages found? Is it so? Again, lymphocytes, monocytes, these are types of WBCs found in blood. Are macrophages really found in blood? Where are macrophages found? You, yes, you. No, I asked him, okay, say. Okay, say. Sit and say. Okay, I am not asking about the function. Where are macrophages found? In tissues. So they come from the blood, they are monocytes, which are the largest WBCs. They are converted after 2 to 3 days remaining in the peripheral blood, they enter the tissues, different tissues of the body, and macrophages are found in different regions of the body, in different tissues, and there are different names for the macrophages in the different regions of the body or the different tissues of the body. So these basic things you must be knowing, otherwise WBC has been discussed. So we will not only discuss about this, how these WBCs are contributing to immunity, but what else contributes to protection. You can say the few things, very basic things. What is the role of lymph in the body? Role of lymph. We have discussed about lymph nodes. In clinical examination, we are seeing neck veins, neck glands. So lymph nodes, what is the role of lymph nodes? Lymph nodes, what they do? So they have a role in immunity. Lymph nodes, what is the role of spleen? So basic functions of the different organs. This you must be knowing from school days. Basic functions. I am not asking about the details. So we'll discuss about different types of WBCs, including macrophages. Not write it in a bracket. WBCs, we can write WBCs and macrophages, white blood cells and macrophages. Lymph and lymph nodes. Again, we'll discuss about something called these term, mucosa associated lymphatic tissues, reticuloendothelial system. This is probably an older term, not much used nowadays. It is also, this is what is called nowadays the tissue macrophage system. Macrophages or the tissue macrophage. Reticuloendothelial system, this the origin of the term is like that, reticuloendothelial system, but it is nowadays called tissue macrophage system. The macrophages are named differently in different tissues, and we will discuss also about something called, I am writing it above, there is no space below. The complement system. Maybe these are the few subtopics for just basic discussion. This we will cover these things. Complement system, complements are certain proteins again present in the body that protect us against infections. Some books you will find immunity being discussed, like in the beginning they are just defining immunity and dividing it, that is, it is natural immunity and acquired immunity. Natural immunity, adaptive or acquired immunity. Natural immunity which is present in the host from birth, or we do not use the term congenital immunity, it is not like that from birth. So, the cells are developing, so which is already present in the body and which is acquired, or innate immunity and adaptive immunity. Like this they are starting the chapter. So, the discussion is the same. These things will come under either innate immunity or adaptive immunity. Acquired immunity, T cells, B cells, how they work, T lymphocytes and B lymphocytes. So, maybe these are the components we will discuss in our whole discussion. Reticuloendothelial system, again remember, it is an older term. Nowadays it is called this tissue macrophage system. So, I wrote WBCs and macrophages, the tissue macrophage system, that is what was called the reticuloendothelial system earlier. As if the endothelium of lining the blood vessels also has a major role to play. Likewise, platelets have a certain role, very, even if very little role, but they have role immunity as well. So, see, this is very basic. So, when you have discussed, when GI system was discussed, where is lysozyme present? Right from the starting of GI, it is present in saliva, mucus, lysozyme in nasal secretions. Okay, these in intestinal mucus, HCl in stomach. This acid, one of the roles of acid, though it is a very primary role in digestion. What does HCl do in digestion? You all know by now, but it is also killing the ingested. Some organisms cannot survive in the acidic medium. So, it is preventing against GI infections as well. So, all these are parts of kidney. So, even the flushing action of urine. So, urine not only clears the waste organisms, but the flushing action of urine, that is also helping to get rid with microorganisms which are developing or which are trying to grow in the urinary tract. So, vaccineers, all these things, some harmless bacterial flora, not only harmless, in the GI tract there are certain useful microorganisms like lactobacillus. Now, when we use antibiotics for certain diseases, those harmless or useful microorganisms are killed in the process. That is one maybe side effect of medicine. So, then we have to replenish them from outside, we should. So, all these things, high salt content of sweat prevents growth of microorganisms, or all these things, these are present naturally. These are all parts of, or these components of inborn immunity, which we inborn, of course, the human being has to remain healthy inborn, but physiologically these are these are present. These components are in components of immunity. This even we may call in the respiratory tract, you have heard of, respiratory system is still not discussed, you have heard of tiny hair like structures called cilia, or singular is cilium. So, that is helping away beating the foreign anything trying to enter the respiratory tract towards the outside by the action of sneezing, and in the process mucus is also formed. So, all these are parts of immunity or protective mechanism. So, what is lymph and lymph node, you must be knowing basic things. Lymph is a colorless fluid that is derived from blood, present in lymphatic system, a network of vessels, nodes. Lymph nodes help to trap certain microorganisms, that is the like control stations. They are serving to fight the, that means fight the body, fight against these microorganisms by trapping. So, lymph node is it a, you can say, bean shaped structure or kidney shaped structure, whatever. So, small structures which are present, which are sometimes palpable, and infections they are palpable very, that means prominently, that means they grow, they are trying to. So, why are inflammation occurring? Again, inflammation is a term which you will have to know in detail, it will be discussed in pathology. Inflammation will just go by these words, but every term, some things you have to, maybe you have to memorize now. Inflammation is a term which will be discussed in detail in pathology. So, infection, inflammation near a lymph node, it can swell and sensitive to touch. So, we are discussing about neck glands and neck veins, that we have to examine neck glands and neck glands just during general physical examination. So, lymph node, swell lymph node, painful to touch, or in the clinicians, from the clinician's point of view, tender to touch. So, pain is a symptom, tenderness is the sign. So, which the clinician elicits. So, clinician, for the clinician it is tender to touch. So, swelled lymph node or inflamed lymph node, sensitive to touch. So, if very painful, then the subject may not allow you to touch it for a, so just you will touch it, the subject will try to remove your hand. So, that is inflamed lymph nodes in cases of, say, infections. So, some organs are defined as lymphoid organs, okay, and also can be, so where there are different organs in different locations which are termed as lymphoid organs, which is development or functionally development, contributing to the development of the immune system. Those are called lymphoid organs. So, some terms are not so overlapping. So, these are distinct terms, lymph node. So, what does lymph do? It is transporting cells like blood, obviously transporting these immune cells, filtering out foreign substances. Lymph nodes, they are trapping microorganisms. Lymphoid organs are basically where the development of these, some of the components of immunity take place. So, likewise they are, some are divided among primary lymphoid organs, bone marrow obviously, which are giving rise to the blood cells which are taking part in immunity. Thymus, where the T cells differentiate, and also the secondary organs are spleen, lymph nodes. Spleen is an organ which is, you know, that functions, whatever functions it have, probably it does not have a singular function or a single function which cannot be done, that means which is it, only spleen carries out that function, probably there is no function like that. Like for example, say all these, whatever spleen does, some other body in the organ, mainly some, so you may say site of RBC production. So, spleen is one of the sites, but along with it liver, bone marrow, liver and spleen are taking off after 6 months of intrauterine life, but along with it the liver, obviously the bone marrow, again when the bone marrow is developing. So, most of the functions of spleen are shared functions. Some tissues like mucosa associated or gut associated lymphoid tissues not only trap antigens, antigens means the products from the foreign bodies, foreign microorganisms, or the, and also they provide the sites for the lymphocytes, these T lymphocytes and B lymphocytes. T lymphocytes and B lymphocytes are small or large lymphocytes. So, under the microscope, by proper staining methods, what you are seeing, small lymphocytes and large lymphocytes, you can't differentiate as T and B. So, T lymphocytes and B lymphocytes are mainly those small lymphocytes. So, 1% of lymphocytes is the large lymphocytes, which are mostly also called the natural killer cells. Okay, those are not the natural killer cells, which are again probably part of the innate immunity, that is inborn immunity, and T lymphocytes and lymphocytes are part of the acquired immunity. So, immunity is classified variously. Some books are starting like humoral immunity and cell mediated immunity. What does the word humoral mean? Body fluids, yes. Humor, the word humor means body fluids, which are present in body fluids. Now, like B cells, how they contribute? They produce antibodies. B cells or B lymphocytes, they are producing antibodies which are circulating and contributing to immunity. How we'll discuss a bit how, but B cells. So, in a way as it is coming from B cells, these antibodies, or mature B cells which are functionally active, they are also called plasma cells. Again, they are distinguished from plasma. Sometimes I am going on telling you, try to learn, that means distinguish between similarly pronounced or similarly spelled terms, like we discussed in hematology, hemostasis and homeostasis. So students are making mistakes from the exam point of view. I am telling you, students are making mistakes. I gave an example just in the last first prof exam which happened in October, November. After that, one exam has started, theory part has been taken, that is February, March first prof exam. So in the October, November one, there was a question on shock. It is cardiovascular, shock has been discussed I think by now in cardiovascular system. So blood pressure, how is blood pressure controlled? That is blood pressure homeostasis. Some students were found writing about hemostasis, that is this coagulation pathway and all. So completely different. Like that, there may be similarly sounding terms, many things which are completely distinct terms. Okay, so we have to be careful about those things. So what we are telling here is humoral immunity, cell mediated immunity. So cell mediated immunity, plasma cells. Plasma cells is not plasma. Plasma cells are modified or functionally modified B cells, B lymphocytes, which are producing antibodies. So humoral immunity for components of immunity which are circulating in body fluids and contributing to protection. Okay, but cell mediated immunity, we mainly talk about T cells. So although B cells are cells, plasma cells are themselves cells, but B cells or plasma cells are usually classified under humoral immunity, as they are functionally contributing through the means of antibodies which are circulating in body fluids. So they contribute to humoral immunity. So this classification has been made by us, means has been made by human beings. So in the body does not know about this classification. So usually we classify, for the sake of understanding, we classify it like this, as B cells are contributing to antibodies which are circulating in the body fluids. So that is contributing to humoral immunity. Cell mediated immunity, we are talking of all these WBCs, macrophages and all, which are cells, monocytes, macrophages, neutrophils, everything, eosinophils. In case of, if we classify it like this, innate and acquired, then acquired cell mediated immunity, T cells, but innate cell mediated immunity are these, all these other WBCs and the macrophage, tissue macrophage system. So it can be classified differently. So what is the bone marrow or just the origin of B cells? Is Bursa fabricus. It is one organ in the birds. So B, the term B comes from that. Again the term T comes from what? T cells? Thymus, where they are developing, thymus. So site of peripheral synthesis, like T cell maturation occurs in the thymus. Nowadays it is told that thymus also secretes certain hormones. Probably they are having like autocrine or paracrine action. So hormones were due to start on Monday, but we could not start it due to some reasons. Classes were suspended on Saturday. So hormones will be started in the next class, next Saturday. So autocrine action, paracrine action, hormones usually act at sites away from the origin gland. They are carried by blood. Definitionally, that suits the definition of hormones, that is, they are carried by blood to a distant place in the body where they are acting to distant tissues. Some hormones are acting all over the body, like thyroid hormones are coming from the thyroid gland, but acting all metabolically active tissues. So they at least they are acting away from the organ, but also the metabolism of thyroid tissue itself, that is obvious. But some are there which are some chemical agents or chemicals are there which are acting in the same organ or maybe in the surrounding regions. Those are called autocrine or paracrine method. Endocrine, in the endocrine system, autocrine and paracrine. Likewise, thymus is secreting some, like thymosin, thymomodulin and all these things. These names are there, certain chemicals which have been differentiated or which have been identified, which are helping in, the role is same, maturation of T cells. Okay, so thymus, so thymosins, thymomodulin that will be discussed. There is a few lines will be discussed because they have mentioned in the syllabus about the pineal gland and the thymus in the section of endocrine physiology. So secretion of the peptide hormone. These are peptide hormones. Again, hormones are either mostly hormones are steroids or peptides, okay, or amine derivatives. So this will be discussed along with hormones. So this will be, the thymus is responsible for the development of or the functional maturation, functionally maturating the T cells. So also the spleen plays a role. Again, we told the spleen probably does not have any function which is exclusive to itself. Spleen plays a role in the immune response by detecting pathogens and some producing some white blood cells sometimes, or they take over when bone marrow has reached its limit. So when the bone marrow has reached its limit, but the body, in a way, the body has to fight more against, so the spleen takes over. Spleen plays an additional role, it complements, it also produces some compounds like opsonins that help the immune system. So these opsonins, there are other terms like properdin and all, but opsonins we talk about. These are certain compounds which have been identified. So I think anatomy of the lymph nodes you will better maybe already have discussed in anatomy or basic anatomy, you know. So lymph nodes, they are like, we talk of the cortex and the medulla in different organs, like we mainly talk about it during discussion of adrenal, the adrenal gland, adrenal hormones. Adrenal hormones are produced, some from the adrenal cortex, they are distinct, they are steroids, they are chemically steroids, some are from the adrenal medulla. When you talk about the kidney, we discuss it along with the renal medulla and the renal cortex. So cortex is the portion outside. So outside the cortex, inside is the medulla. Inside portion is medulla, outside portion is cortex. Likewise, in lymph nodes, B cells resides in both in cortex and the medulla, but T cells, they in the deep cortex. That means outer part, but the deeper, not as deep as the medulla, but in the deeper parts of the cortex. Okay. So we will discuss similar things, that what is the functionally or anatomically the inner part of the cortex, the outer part of the cortex. So when we discuss the renal system, we will discuss several, not several, but one or two aspects like that. So some tissues, we were talking of mucosa associated. So along the mucosal lining, these mostly, some things you have to memorize, like you can understand, but you have to know what are they. Mucosa associated lymphoid tissues. So the tonsils, Peyer's patches, and even the appendix. Earlier there was an idea that the appendix has no role in the human body, absolutely no role. So it is a functional organ, but everything, science evolves over time. So nowadays we know appendix maybe has some role in immunity. This is one of the lymphoid tissues which is protecting the body from some foreign bodies at least. So vermiform appendix has also come under the purview of this mucosa associated lymphoid tissue. So when it was considered no role, even earlier days there were, so modern days there are so many investigations available. So in earlier days means even say just 25-30 years ago, even ultrasonography was a very, say, in a way I may say advanced type of investigation. There was no MRI, say all these things like this. So ultrasonography, even without ultrasonography, clinically feeling, okay, appendix, it is paining in the right side of the abdomen, paining in the right side of the abdomen. We will read about it. You will, when you go on studying in medicine or surgery, that there is one point in the over the abdomen called the classified as the, or the identified as the McBurney's point. So when that was clinically tender McBurney's point, that means it was taken to be a diagnosis of appendicitis, and appendix was usually removed surgically. If it was, most cases it was decided that appendix has to be removed, it has no role in the body. So as it has no function, what is the use of keeping it when it has further chances of infection, inflammation again and causing further trouble. So, remove it. So, then it was believed that appendix has actually no role. Still now we will go, obviously if it causes much trouble we will have to remove it, but the concept is now that appendix, that absolutely it has no role, that concept has changed. It is a part of this immune system. So, different mucosa associated lymphoid tissues include all these along the gut, along the bronchus, along some reproductive organs, along the conjunctiva, all these the skin associated along the reproductive organs, all these, sometimes these are diffuse or sometimes they are organized, like in Peyer's patches in tonsils and all the Peyer's patches within the small intestine, these are organized or these are diffuse. Some tissues where these are taking part in immunity, these are all examples of that lying along the different parts of the body. So, in the genitourinary tract in females as well as in the reproductive tract in males, in the GI tract, in the gut, everywhere there these types of tissues are there which are. So, one organized tissue in the gut is this example is Peyer's patches. So, you do not need to know an extensive list, but know few names which are very commonly used or we refer to them, so that you can write. So, one example is Peyer's patches. So, they are giving the, say they give 4 certain names which are very recognized names, but one of them is a mucosa associated lymphoid tissue. So, it will help you to tackle MCQs, otherwise extensive list is not required. Nobody will ask you write the names of 10 lymphoid tissues or 10 mucosa associated lymphoid tissues, but Peyer's patches, yes, if other options in the MCQ does not conform to this immune functions lymphoid tissues, then it is not classified. So, one example of MALT is, say they are giving Peyer's patches and other 3 which are recognized tissues, but not contributing to this lymphoid tissue. So, you have to mark Peyer's patches like that. So, all these things, Peyer's patches, appendix is now considered, thymus, tonsils and adenoids, all these things, lymph nodes, lymphatic vessels are contributing to. So, macrophages, again we told macrophages are modified, or we should not say modified, monocytes which are coming into the blood from the bone marrow, staying there for 2 to 3 days and then passing on to tissues. In different cells they are differently named, like in liver they are called, the macrophages are called Kupffer cells. Even osteoclasts in bones are considered as macrophages. Osteoclasts we know them as, bone physiology will be discussed after some days along with parathyroid hormone. Osteoblasts and osteoclasts. Osteoblasts are helping bone forming cells, osteoclasts are disintegrating cells which are contributing to disintegration, they are osteoclasts. So, they are one type of macrophages. In the central nervous system, in the brain and the spinal cord, they are called microglia, singular is microglium. You may have heard the term, nervous physiology has been discussed to some extent. So, again you will get the term in central nervous system, pulmonary alveolar macrophages in the lungs, lymph nodes we have already told, reticulum cells. So, some cells are found in the they are found in the spleen, they form a network like structure also in some other tissues. So, earlier this same system, this reticuloendothelial system, this tissue macrophage system was also called the reticuloendothelial system. These are the, in the different regions, the tissue macrophages. In the liver they are called Kupffer cells. Some books are writing also the glomerular mesangial cells have also some role in immunity, glomerular mesangial cells in the kidneys. But primary you should say about macrophages in tissues, tissue macrophages, very prominent are Kupffer cells, pulmonary alveolar macrophages, microglia, these should be the most prominent examples of these tissue macrophages or the tissue macrophage system. This is how a macrophage is looking like. So, monocytes, as you know, see, you have seen it under the microscope, monocytes, nucleus of a monocyte, a kidney shaped nucleus. So, this is how they are looking like and how it contributes to phagocytosis. Phagocytosis you already know What is phagocytosis? So, it is contributing to phagocytosis, ingested bacteria forming the vesicle. So, is it a form of exocytosis or endocytosis? Endo or exo? Endocytosis. So, phagocytosis is a form of endocytosis. Lymphocytes, T cells and B cells, and also part of the innate immune system, the larger lymphocytes are called the natural killer cells. Natural killer cells. So, there is not much to discuss. Lymphocytes, if you classify it, either, although they are using the term here large granular lymphocytes, don't confuse them with granulocytes. Lymphocytes have no granules, okay. Lymphocytes are maybe few, but say large lymphocytes and small lymphocytes. Part of the innate immune system are the natural killer cells, part of the acquired immune system are the T cells and the B cells. So, functions of T cells, there are different types of T cells. We will again discuss helper T cells, cytotoxic T cells. Some T cells are assisting the B cells and some T cells are actual destruction of the invading organisms. Some T cells are regulatory. Yes, what makes you laugh? Be attentive in the class or do something by yourself. Don't do something which disturbs others. তোমার যা খুশি করতে ইচ্ছে করে নিজের মতো করো, পাশের জনকে যে শুনতে চাইছে তাকে ডিস্টার্ব করো না। Regulatory T cells, so they probably have some role, that they have no direct role in killing invading organisms or maybe helping B cells, but they are maintaining the ratio of this effective functionally active T cells. How many T cells should be killer T cells, how many should be helper T cells. So, this after even an infection has cured, the helper T cells no more need to act. That is regular, those T cells are probably regulating that, help the, so the name the regulatory T cells. And B cells, what they are doing? B cells, they are not only recognizing antigens, we will discuss about again antigen presenting system. So, they are recognizing some antigens. T cells are also doing, they have receptors, T cell receptors, B cell receptors are there, which helps to recognize antigen, but modified functionally active modified B cells are also called plasma cells, which are actually, don't do that, that is not allowed. We have told many times in the class, just delete that. Why we have told you? I have not discussed, I have not told it one time, I have told it multiple times. So, B cells, functionally modified B cells are plasma cells which secrete antibodies, which is the how the B cells act, and which we talked about that humoral immunity, because they are present in these antibodies are going around in body fluid, so they contribute to humoral immunity. Those are plasma cells. Immunoglobulins, so immunoglobulins, we will discuss types of immunoglobulins. So, B cells, the antibodies are also called immunoglobulins. Where have you heard of immunoglobulins till now in physiology discussion? When we discussed blood grouping, yes. So, RH, anti-RH antibodies, some cross the placenta, some don't, some are IgM type, IgG type. So, where we have just mentioned about this immunoglobulins. This is not very clear difference between T cells and B cells, not very clear picture. Again, T cells are produced in the thymus gland, they mediate cell mediate immunity, and B cells mediate humoral immunity. What we already discussed, those things are written. These are the, in the receptors there are certain sites, so nothing much. So, some stem cells can develop into B lymphocytes, and B cells are the producing, then differentiating into plasma cells. Again, don't confuse plasma cells with blood plasma. Plasma cells are modified B cells which are secreting antibodies. All these we have discussed. Reticuloendothelial system we have just mentioned, that is network of specialized system which is taking part in phagocytic activity throughout the body, but this is better called tissue macrophage system. This is no more called the reticuloendothelial system. Tissue macrophage system or monocyte macrophage system or mononuclear phagocytic system. Mainly we talked of mononuclear phagocytosis, polymorphonuclear, these white blood cells, mainly polymorphonuclear white blood cells. We talk of neutrophils, but also when you talk of the broadly speaking mononuclear phagocytic system, they should speak of this tissue macrophage system or the lympho-reticular system we may call, because lymph is also involved. So, lympho-reticular system, these are some functions. So, mainly this, as spleen is also included, destruction of senile RBCs, destruction of hemoglobin is also considered as a part of the function of reticuloendothelial system. But if you concentrate mainly on the immune functions, then these phagocytosis, secretion of some products, okay, which are platelet derived growth factor and all those products, all are coming under the, these are functions of reticuloendothelial system. That is why endothelium, blood endothelium, platelets, they are also considered a part of immune system. So, immune functions, but except that destruction of these old RBCs which are no more functioning RBCs, along with that hemoglobin is also considered, because spleen, where the destruction occurs, spleen is also considered a part of the reticuloendothelial system. These tissue macrophages, fixed macrophages, tissue macrophages, same thing, whatever we are discussing, we have just discussed all these things. These fixed macrophages or tissue macrophages, they are also called fixed macrophages, as if they are fixed in those tissues, and some are, if they roam about in the blood, very few, they are called the free or wandering macrophages. Now, then comes certain things which we just mentioned, that in some books, in the beginning of the chapter on immunity, we will get this thing, the classification of immunity. It is either innate or it is acquired, adapted or specific defense system. So, this is, one is external, one is internal. So, we can divide it, we can classify it variously. So, it is either innate or acquired. Most books are writing like this, first line, second line you will not get, I do not think you will get like that in books, but at least you have to mention innate immunity and acquired immunity, or it is called adaptive immunity, or immunity is also non-specific, not directly against that certain specific microorganism, that is innate immunity, like these physical barriers, this lysozyme, whatever we spoke of, lysozyme, gastric juice, acid, gastric juice which contains HCl, anything, any chemicals which are in the reproductive tract, everything, all those are coming under the purview of this cilia we mentioned, that was not mentioned in that slide, cilia. So, that is external defense, first line of defense, or the internal defense, all these WBCs, macrophages, complement system we will discuss, interference and certain cells which are helping combating viruses, those things. Even they are mentioning fever is a symptom actually, but fever is actually the fever is itself not a disease, it is the manifestation of something, that something has gone wrong. So, that is the manifestation, the body temperature has risen. So, that is, they are even mentioning it is fever is, do not write it as a component of immunity, although they are writing. So, but you have to write about, or you have to know about interference, all these macrophages and other WBCs, natural killer cells, obviously these are part of innate immunity, and for the acquired immunity it is B cells and T cells, and passive immunity is when antigens are introduced into the body, they produce antibodies and they are helping, those antibodies are helping in fighting antigens in future. So, this is, have you heard the term in community, or you have heard it commonly, but you will read about it in community medicine, that is, this is what is the purpose of vaccination. We are giving vaccines. So, there is a national immunization schedule. So, at this age, even on the 0 day, that means on the day of birth, vaccinations are given to the child. So, that is a part of a national immunization schedule, it is mentioned. You have to know about the national immunization schedule in detail, that what vaccines, and those are sometimes changing. This is national immunization schedule, you have to know about your country. Obviously, this is talking of your country's national immunization schedule. So, vaccination is passive acquired immunity. So, we are introducing an antigen. So, you will hear terms like live attenuated, that means they are live antigens which are introduced in the body that are attenuated, but their function is, that means their harmful function, that is they are treated in such a way that are harmful functions are or harmful action is neutralized. So, they have the capability of producing antibodies, but they do not have the capability to harm you. But even then, sometimes some side effects have been noticed. There are certain side effects, but usually they do not cause direct disease. But when actually antigens which have the capability of causing disease has entered, the antibodies which are produced from these vaccines are then fighting it off. So, that is the principle behind vaccination. So, that is like a passive, it is introduced from outside, it is passive acquired immunity. And what is active one? Then what we are talking of, the T cells and the B cells, or antigen presenting cells. B cells are themselves antigen presenting cells, macrophages are antigen presenting cells. We will discuss about that in at least mention some lines about that. So, this is again active immunity. It can be again natural, that is where the T cells, B cells are acting, macrophages are acting. Artificial immunity response to vaccination, passive immunity natural, and artificial is antibodies. Directly we are giving antibodies, like one example is, again will be discussed in community medicine. Yes, okay. Better example is tetanus, when tetanus toxoid is vaccine. Okay. So, that is given prophylactically. In medical science, prophylactic means which is we are giving for prevention. But once say a dog bite has occurred, or not only dog bite is really more relevant to rabies, tetanus, any cut injury. So, tetanus, if there is any, we are finding that symptoms may be occurring or there is a chance of the disease. So, at that time immunoglobulin, which are from outside, antibodies given from outside. So, directly the antibodies are given, not the antigens. In vaccination, antigens are given, but they are live forms of antigens, live forms of microorganisms, but their harmful action has been neutralized. But these are directly the antibody from which antibodies will be produced by the body. But in case of natural artificial passive immunity, that is that directly antibodies are injected, so that they can combat the antigens. Classification of adaptive immunity, again on the basis of mode of development we have already discussed, but basis of effector molecules, again where they are acting. Humoral immunity, those are circulating body fluids, or cell mediated immunity, talking of T cells. In case of acquired immunity, cell mediated immunity is about T cells. In case of natural immunity, cell mediated immunity is about WBCs, the tissue macrophage system, and the natural killer cells, also some called the interference. Again you can write this, you can make this yourself. So, if you are asked to write differentiate between natural and immunity, whenever it is asked to compare or contrast or differentiate, just try to make a column, that means try to make a table. Do not go on writing say 10-15 lines. So, this creates a better impression, as well as it helps to maybe when, as still the process is not MCQs, we are not being evaluated by MCQs, like in some cases in some NEET postgraduate exams, everything is about MCQs. So, they are evaluated, the scripts are evaluated by the artificial intelligence, computers, but still now you do not have a system like that. So, as is some human being who is evaluating the theory answer scripts. So, impression plays a role. So, if you answer one or two questions well, maybe it has some good effect on some answers which you may not be answering, the answer may be an average one, but still you are getting good marks just because the first few questions. So, it is always better to write which questions we know better, which answers we know better, it is better to write them earlier, okay, in the answer script. So, whenever it comes natural immunity, acquired immunity, we just try to make a table, like what are the cells What does it mean? What are the cells? It is not specific. Very easy things if you know about the things. So innate immunity again and adaptive immunity. We just components of innate immunity. Okay, we can just complete. We have already discussed, but okay, innate immunity and adaptive immunity. Mast cells. Okay, we have to discuss about some mast cells. Monocytes, macrophages again come. Okay, we'll continue next day. Same. Innate and adaptive immunity will continue next day, and we are left with complement system. I think we'll require, if we can complete, we'll complete in the next class. Otherwise, we'll require one more class.